Hello everyone, welcome to Move Well, Live Well. We've been getting a number of people coming in here with issues regarding their knee. And what we're seeing is they're starting to develop a condition called Chondromalacia Patella, also known as runner's knee. And we're seeing this a lot. Obviously people who are active, do a lot of running, that type of thing. Even, recreational weight trainers also get this with the squatting and stuff that they may be doing. But what Chondromalacia Patella is simply that. It's, if you break down the word chondromalacia, chondro meaning cartilage, malacia being bad, and then patella, kneecap. So essentially it means bad cartilage of the kneecap. And what we're seeing, what Chondromalacia Patella is that the underside, this is the outside of the kneecap out here, and then on the inside surface in here, the inside surface of the kneecap, the cartilage has been damaged in some sort of way, or it's starting to wear away altogether as it rubs up against the condyles of the femur. This is your thigh, and the bone of your thigh is called the femur, and then you have the condyles of the femur that articulate with the kneecap. And as the knee bends like this, as the kneecap is right here, if my hand is the kneecap and this is the condyles of the femur, you can kind of see it rubs against that kneecap. And over time, you can get that wearing away of the cartilage on the inside part of your kneecap right here. So, why is this happening? What we're finding with these folks is that they're starting to lose range of motion about their knee. Now, the knee can extend, so this is knee extension, and this is knee flexion, all right? So, extension and flexion. And what we're finding with these folks is that they're missing flexion of the knee. So as they go to bend their knee, a knee flexion, they're missing some of this range of motion. A lot of these folks, they only can get halfway here, and then that's all that they can get. They can no longer go. Ideally, you should be able to try to touch your heel to your butt. That would be ideal. Normal knee flexion would be to be able to touch your knee, heel towards your butt. And these folks, they're having problems doing that. They can only get from here to here, and it's really, really tight and discomforting with having to do that. So they're getting this condition called Chondromalacia Patella. They're getting pain when they go up and down stairs, sometimes a clicking, and it could be very, very sharp, or just a general discomfort, sometimes swelling in through the knee with this condition called Chondromalacia Patella. So how do we fix this? How do we change that range of motion about the knee so that way the articular surfaces, the joint surfaces of the kneecap and the condyles of the femur are much more looser and they glide better together? Well, if your range of motion is decreased about your knee, the quadricep will push. So if you could imagine this, if my quads are tight, they'll pull. They pull this way, right? So if my quads are tight, they're going to pull this way. They're going to push the kneecap harder into the condyles of the femur. So with every time I do this, it's just going to push that kneecap harder into the condyles. And over time, that's going to continue to wear away the cartilage on the underside of your kneecap, as well as the condyles of your femur, and you'll eventually have to get knee replacement surgery. So we don't want that. So how do we manage when you start getting conditions like Chondromalacia Patella, so that way you don't have to get knee surgery down the road? Well, you want to create normal range of motion about your knee, so that way when you bend your knee, it gets full range and there's less pressure for the kneecap to be pushed into the condyles of your femur. So, quadricep. We're going to work on the quadricep muscles. There's 4 muscles to your quadricep. That's why they call it quad, right? Four muscles. You have the vastus medialis, which is that teardrop muscle on the inside part of your thigh. You have the vastus lateralis, which is on the outside part of your thigh. And then you have the vastus intermedius, right here, kind of in the center, kind of toward the right a little bit, but kind of in the center here. And then you have the rectus femoris. So you have those 4 muscles that make up your quad. And so we're going to take the good old handy dandy rolling pin. Now, don't be spending a lot of money. You can go and spend a lot of money on a physiotherapy roller, but you can just go to your local grocery store, Walmart, Target, local grocery store will have these for a lot less money than a physiotherapy labeled roller. And if you're going to steal one from your spouse or significant other, make sure you let them know and you replace it. So you don't want to take this out of their kitchen without them knowing, because that would be bad. So anyway, you take the sucker. Let me do it this way so that way you guys can see better with my quad. And I usually recommend you doing this. I recommend you doing this from distal to proximal. So start far and work your way up. So I'm going to start right in here, closest to the kneecap. Right in here, this vastus medialis. And you want to search and find those tender spots. And when you hit a tender spot, don't just roll over it quickly. Oscillate right into that tender spot a little bit. See that? Oscillate in that tender spot a little bit for a period of time. Don't just sit there and roll. You can do global rolling, that's fine too. But you really want to search and find those really tight, tender areas, because those are areas of tissue that are no longer pliable. They're just kind of balled up in there, so they no longer contract and relax in a proper way, giving more pressure to the kneecap, pushing into the condyle. So here we are. And I'm working my way across. I'm working my way across the kneecap here. So now I'm kind of in the middle. See that? Right there. And I work my way over here. See right there, there's a good spot for me right there, that vastus lateralis right there up against where that kneecap. And that's what it is. It's a kneecap tracking issue. In other words, as the quad extends, as the quad contracts and relaxes here, as the quad contracts, relaxes, the kneecap gets pulled in different directions. And if one of the quadricep muscles, one of those four, are pulling it in different ways, you're going to have abnormal wear and tear of that kneecap underneath. So you want to evenly distribute the wear so you don't get that improper wear through there. So right in here. Yeah, right there is a good spot for me right there. It's just like that. Just oscillate back and forth and through there. Ooh, that's a good one. And there's another condition, there's another video for it. If you want, you can go refer to it. It refers to the IT band, where you have pain on the outside part of your knee typically. Pain on the outside part of your knee. And it's tightness within the IT band, iliotibial band. It spans from the tibia all the way to your ilium. And it's basically a band of tissue, a sheath of fascia that encases the quadricep and the hamstring in a good position. But sometimes the gliding surfaces between your skin, the IT band, your quads, sometimes aren't very good anymore, and then you need to do some of this stuff with that as well. So look that up. It's in the lower extremity playlist. You can find that IT band. But that goes along with this particular video too. But today we're working on the quadricep, specifically because it attaches here in the patellar tendon to allow you for knee extension. So here we are, right in here. And then you work your way up. Again, work distally, and you work toward proximal. So you're working up toward your hip bone. So you're working up toward the hip bone. So toward your heart to increase circulation and venous return, right? Remember, the veins have one-way valves. The reason why I recommend going from distal to proximal is the veins have one-way valves in your legs, in your body. Not just your legs, but in your body. One-way valves going toward the heart, because that's what the veins do. They return blood toward the heart. And if you're trying to go the opposite way that it wants to go, you can actually create damage in those valves of your veins, and that's not good. So that's why I always recommend towards your heart, because you want to create that venous return, that circulatory return, and minimize damage to your veins. So here you are, toward the heart. See? So in other words, as I go down, I'll put pressure this way. I'll release pressure, go down, pressure, release pressure, down. See that? Toward the heart. Okay. So that will help to increase range of motion, decrease that tightness and those spasmed out areas of your quad, and thereby increasing range of motion of your knee, so that way it decreases the pressure up against the kneecap, against the condyles of your femur, and help reduce the discomfort with chondromalacia patella and get you back to healing, get you back to your activities quicker. If you have any questions, leave them off in the comment section below. We thank you for watching. We appreciate it. Please like, subscribe, and share. And when you hit subscribe, make sure you hit that bell notifications button so you don't see any, miss any of the videos coming down here in the future. Again, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.